سعداء جدا ان نلقاكم مره اخرى في بيتنا في بيت اليونيسف. اهلا وسهلا بكم جميعا. هذا الاسبوع نحيي ذكرى في غايه الاهميه، نحيي ذكرى 30 عام على اتفاقيه حقوق الطفل. يشرفني ويسعدني جدا ان اقدم السيد شعيبان المدير الاقليمي الجديد لمنظمه اليونيسف في الشرق الاوسط وشمال افريقيا. الكلمه لك.
Shukran, Juliette. Good morning, everybody, and apologies for being a bit late. It's great to have you all here and to have this opportunity to be with you for this first press encounter as Regional Director for the Middle East and North Africa for UNICEF. It's a special day that we're celebrating today. It is a major milestone for children's rights. It's about 30 years since the Convention on the Rights of the Child was adopted on the 20th of November 1989, and it's really an opportunity 30 years on to celebrate both the progress that's been made, but also to highlight some challenges. Let me first start by speaking about progress, because in this region we always think about crisis, we think about conflict, but we don't often enough, I think, speak about progress. And let me start first by saying that every country in the Middle East and North Africa has ratified the Convention on the Rights of the Child, so it's turned it from international law to international law. And that's a very important step in moving forward with applying the provisions of the CRC. Overall, in this region, we've seen some very significant progress for children, and I'd like to highlight a few areas where the region has done quite well, despite the fact that there's issues with governance, with conflict, with climate change. In this region, we have almost universal vaccination coverage. We have good health care. We've got quite good water treatment and sanitation. And this has resulted in a more than 2/3 decrease in child mortality rate. So in 1990, 65 children out of every 1,000 children born died before the age of 5. That number is now less than 21. So we actually exceeded the global goal when it comes to under 5 mortality reduction. Second, we have more children in school today than ever before in history. There are more children learning in school today than ever before in history. Third, even though the Middle East is known as a water-scarce region, a region where there isn't a lot of water, the population, in fact, has access to both safe drinking water as well as sanitation facilities. So over 90% of our children have access to clean drinking water, despite some of the challenges with water. And then we have a young population. We have a population that is full of potential. We have a population that is, young and presents an opportunity for the region. So those are some of the areas of progress. Now, despite this progress, there are definitely challenges. And I would say one key challenge is the fact that this progress has been uneven. If you break away from the average of the region, you'll see many differences within the region or even within a country, within geographic regions of the country, or between different classes within a society. And what we see consistently in the region is that children from the poorest quintile, the poorest 20% of society, do a lot worse than the children from the richest 20%. That's not unique to the Middle East and North Africa, but we've got some significant disparities in this region. So that's one issue. The second issue is that when it comes to education, while children are in school, the quality of what they learn is not always very good or very relevant. So what we have is only half of the children in school meeting internationally recognized benchmarks when it comes to learning. So the issue of quality of learning is key. A third challenge in the region, and one which you will not be surprised about, is the fact that we have the highest youth unemployment rate in the world in this region. So our young people are not finding jobs. They're educated, but they don't necessarily find the jobs that they would like to find. It'd be good if people showed up on time so that everyone else doesn't have to be disturbed, as the case may be. But let's give it a moment. Sorry.
وصل على المكسر شوف والله المكسر.
You can take someone else's feet if you're not ready. Okay, can we continue that? So we were talking about some of the challenges, and one important issue that we're not necessarily discussing in this region is the whole issue of violence. I'm not speaking about violence due to conflict. If you look at children in this region, and this is not, again, unique to this region, 4 out of 5 children experience some form of physical or psychological violence. And that violence is primarily at home or at school. It's domestic violence, it's corporal punishment, it's bullying, it's online violence. So we need to also understand that violence is a broader phenomenon than originally anticipated. We've done, as UNICEF, a survey, a public perception survey, which I think is available publicly. Is that correct?
I can comment on that. It's not actually, but some of it is.
We'll make it. And what it shows is that some of our people and our children in this region are worried that while we've made good progress, they're worried about the last few years, the last 3 years, and they're not sure they can answer the question, are you doing better now than you did 3 years ago, positively. So I think we're at a point where we need to kind of hold those children's rights and respect them and take them forward. And then, of course, in the midst of all this, progress, challenges, we do have this issue of conflict in the region. So there's 175 million children in the region. Children for us is anyone below the age of 18. Of those 175 million, 25 million are living in conflict countries. It's a high number of children living in conflict countries. And they, of course, have very special needs. We have 3/4 of the children that need humanitarian assistance in this region come from these conflict countries. And the conflict specifically in Syria and Iraq have left tens of thousands of children who were previously in areas held by armed groups with high degrees of vulnerability, psychosocial support needs, need for reintegration. Let me speak for a moment about these children in particular. So again, the picture is 175 million for the region, 25 million overall living in conflict-affected country. And then there's a smaller group of children who are living in areas held by different armed groups, so the scene of active fighting. And within that caseload, there's children who had families who were in areas previously held by armed groups. They themselves might have been associated with those armed groups, but they're children too, and they need to be taken care of. So in this case, there's currently in Syria, for example, 28,000 children from more than 60 different countries, including 20,000 Iraqi children who remain in northeast Syria, many in displacement camps, some in detention. More than 80% of these children are under the age of 12. Half are under the age of 5, so they're there because their families were there. It's not something of a choice they made. And for these children, we really urge that detention should be a last resort and only for something they have done, not because their family has ties to any given armed groups. We urge that there's opportunities to reintegrate them into their society, whether their society is Syria or Iraq or indeed any of the foreign countries they came from. We urge that they not be rendered stateless, so that they have access to the necessary documentation, the birth certificate, the nationality that they are have a right to. And we urge that we can reach them with humanitarian assistance, that we can reach them with the kind of support that they need as children. I think the main point is to try to get them back into a family environment, a community environment, wherever they come from. And then if there's a need to look at any kind of juvenile justice procedures for things they themselves have done, then to use the right appropriate juvenile justice procedures in their countries of origin. So those are the children in those areas of Iraq and Syria. Let me then go back to a slightly optimistic message to finish. This is, as I started in my first sentence to say, the 30th anniversary of the Convention on the Rights of the Child. It's the most universally ratified convention in the world. Every country except one has ratified the convention, and all have signed it. And it really is an opportunity for all governments, the private sector, civil society to continue to say, how can we advance child rights? And you know what our children and young people, and again, I have to remind you that for UNICEF, children is anyone below the age of 18, so it includes adolescents. What our children are asking for is good education, clean water, electricity, clean cities and villages. They're worried about the climate change that is occurring, and they would like us to take our responsibility in addressing that climate change. They're asking for security and safety and protection from violence. They're also asking for jobs, for their voices to be heard. They want to participate in the development of the nation. And they're asking for freedom from abuse and exploitation. And most of all, they're speaking and asking for dignity. Dignity of life for themselves and for their families. I think in Arabic we call it karama. They're asking for karama. And they are asking for things that frankly all of us want. All of us want for our children. So if these are things we want for ourselves and we want for our children, we should work together to make sure that every child has these things for them. And I think the media, the press, people in your profession have a key role to play, because you can highlight both those aspirations, those challenges, but also the solutions. Focus on the solutions that are so important to move things forward. So those are my opening remarks. I think Juliette is going to give us an opportunity to have a bit of an interaction and an exchange. Like I said, it's a pleasure to be with you. I understand some Arabic, so if I don't put the headphones, it's because I'm understanding what you're saying. At some point during my time here, I'll do an interview in Arabic, so one of you will be my first Arabic interview. But it won't be today. So today you can ask in Arabic, I will respond in English most likely. Hopefully the translation will be able to keep up with us, and I hope I'm speaking slowly enough that they can do a good job translation for you all. Thank you.
Thank you. شكرا جزيلا. نفتح المجال لبعض الأسئلة، ولكن أيضا قبل إنهاء المؤتمر الصحفي نختتم مع فيلم قصير. بداية الأسئلة. Go ahead.
صباح الخير، نادين نمري صحفية من جريدة الغد. تطرقت في كلامك عن الأطفال الموجودين في سوريا من جنسيات أخرى. كما هو معلوم في مشكلة للأطفال أبناء الأمهات الأزديات الناجيات من العنف. هناك إشكالية، هذول الأمهات ما بيقدروا ياخذوا أولادهم معهم على بلدهم. قد إيه حجم المشكلة بالضبط؟ وهل في تواصل لليونيسف مع المنظمات المحلية ليتم شمل الأمهات مع أطفالهم بسنجار أو يرجعوا على بلدهم وتسوية المشكلة؟ وفي حال كان في رفض مجتمعي، هل عم تبحثوا على حلول أخرى لضمان بيئة جيدة؟ وقد إيه الوضع لهدول الأطفال؟ هم بملاجئ أم هم في مراكز اعتقال؟ وسؤال آخر حول الوضع في اليمن، لأنه يعني دائما اليمن والوضع الإنساني فيها عم يكون مسيطر. كيف تقييمكم للوضع في الشهور الأخيرة فيما يخص الأطفال اليمنيين؟ شكرا.
Thank you very much. Let me answer both questions. First, to say that, so as I said, in terms of the children, and the situation is slightly different in Iraq and Syria. In Iraq, which is at a different stage in terms of where it is with its internal issues, including the conflict there against armed groups. There has been much more movement on getting larger numbers of children back to their countries of origin. There's a whole process in place with the different ministries of Justice, Ministry of Interior, in order to get children back there. When it comes to Syria, which again, it's a newer phenomenon in the Northeast in terms of areas of control and military operations. We estimate that there's around 28,000 children who are affected directly in terms of having formerly been in areas previously held by armed groups, and either their families or themselves were directly associated with those armed groups. These 28,000 children come from 60 different countries, but what's also important to state is 20,000 of them are from Iraq. So the largest caseload by far is from Iraq, and there are discussions about having those children go back to Iraq, where hopefully they will be treated as children, face restorative justice if there's any justice to be faced, but mainly return to their families and communities and in fact not be held, which is what we would request. For the caseload as a whole, as they are currently, and again, just to remind, I spoke about the age groups. 80% are under the age of 12 and half are under the age of 5. So clearly, a lot of those children aren't there by choice, they're there because they're family.
How many under the age of 5, sorry?
Half. Again, from out of 28,000, yeah. So this is again, these are orders of magnitude, they're not exact figures, it's what we've estimated and know from the information that we have. So clearly they're not, most of those children aren't there by choice, they're there because their families were there. Some are in displaced camps, some are in detention facilities, and our point is that we need access to these children, they should have quality humanitarian assistance, they should be with their families, and if they need to face some kind of justice procedure, it should be a juvenile justice procedure, it should be a restorative justice procedure, because for us, anyone below the age of 18 that's associated with an armed group is there against their will. They're a child first and foremost, and it's essential that they be treated as a child. In terms of this caseload in Syria, by and large, member states have worked their own arrangements out to try to remove and get children out of Syria. We continue to advocate with those member states to take their children and the mothers where possible, but certainly the children, and to make a best interest determination in each case. So, but each individual case needs to be assessed on its own merits to determine what's in the best interest of that child. But for many of these children, the best interest is to be out of the current circumstances they're in and to be somewhere with family in a safer location. Could be an extended family member if there's no immediate parents. Lastly, let me say that we also, in certain occasions, have helped on the receiving end. So when the family gets back to places, say in Central Asia or in Western Europe or other places where they're from, North Africa, then again, based on discussions with the local authorities, based on what the needs are of the family, there sometimes is a request to help with the reintegration, but also the psychosocial support to that child. That child has gone through traumatic experiences, they've gone through difficult circumstances, and it's important that they get the support on the receiving end as well. So that's, in a nutshell, the situation when it comes to the children in Iraq and Syria, that case law that we mentioned. When it comes to the situation in Yemen, I was just there from the 6th to 9th of November. The situation is quite serious in terms of humanitarian requirements. There is, I think, an important effort made by the humanitarian agencies in support of the local population, including by UNICEF. And what's important is that we have been able to maintain different systems. So keeping the health system going, keeping the education system going, keeping an emergency cash transfer system going. So if you will, it's a kind of a social safety net that we've been able to keep going. That reaches 1.6 million people each month. And I think that's quite an important form of assistance. Similarly, when it comes to health, similarly when it comes to education. So essentially keeping basic services in place, working with the authorities in different parts of the country to keep going. Clearly, there's no substitute for peace and a peaceful resolution to the situation in Yemen. We hope that there'll be good progress made on the peace talks that are taking place in order that humanitarian assistance, but also more broadly, economic opportunities can resume in the country, because that truly is the solution for children and their families.
شكرا. بس برضو للإضافة لدين الزملاء في اليمن، كل طفل تقريبا بحاجة ماسة للمساعدات الإنسانية. وبالنسبة للأرقام عن السؤال الأول والسؤال الثاني، صفحة اليونيسف موجودة على الويب، فيها كل الإحصائيات وفيكم تحصلوا عليها بعد المؤتمر الصحفي. في أي أسئلة أخرى؟ تفضل الزميل. ممكن تعرف عن حالك؟
I have from the other room just the basic facts on Yemen and some of the other regions. Can you give some figures? Thank you.
أمين سليم من قناة رؤيا. أنا عندي سؤالين. السؤال الأول، يعني بعد 30 سنة على الاتفاقية في تقدم في بعض المجالات فيما يتعلق بحقوق الأطفال، لكن أيضا لاحظنا هناك تراجع في بعض الحقوق، وهناك على الأقل يعني توقف في بعض الأمور التي ممكن تحسينها. لكن هل لدى اليونيسف أي خطط أو أي برامج خلال السنوات القادمة مع الحكومات تحديدا في المنطقة لرفع مستوى الخدمات وتنمية حقوق الأطفال؟ هذا من جانب. الجانب الآخر فيما يتعلق بالأطفال في غزة وفي فلسطين، هل هناك إحصاءات معينة لديكم تقارير حول الوضع الإنساني للأطفال في غزة تحديدا؟ شكرا.
Okay, so firstly, when it comes to, thank you. When it comes to the situation of, when it comes to the situation of cooperation on the Convention on the Rights of the Child more generally in the region, we work in all of the countries of the region to advance child rights. That form of cooperation takes different strategies to go forward. But even in places which are high-income countries and places which are have a good amount of capacity on the ground, there's still a lot of opportunities for South-South cooperation, technical exchanges, and things of that nature that are very helpful. And we are specifically looking at ways that we can work on a number of areas that I mentioned in support of, I would say, countries. So this is both government and civil society to address those needs. Because as you know, in our region, services are not just public services, they also often involve the private sector. So issues around quality of learning, so issues at looking at the curriculum in different countries, looking at the quality of teaching, the training of teaching, the supervision of teaching, parent-teacher associations, how they help govern schools. So there's a whole set of issues around quality of learning that we're looking at. One thing's in places like Egypt, for example, places like Morocco, places like Jordan, where this is done. So that's number one. Number two is looking at the issue of healthcare. There's been a very strong focus in the region on curative care. So, making sure that we have the right hospital infrastructure, that we're able to address disease when it happens. But a big part of health is prevention. So dealing with both behavior issues that can lead to less obesity, less diabetes, issues related to preventing diseases before they occur, whether you're dealing with malnutrition or overnutrition. And as well as looking at reestablishing primary health care, so a very basic level of care, immunization, fighting childhood diseases with community health workers. And the issues there are the work that's being done, again, in a number of countries in the region on that. So that's the second area of intervention. Thirdly will be the area of this transition to work. So how do adolescent and young people have not just learning in their schools, but also the opportunities to have the kind of skills that make them attractive when it comes to employers. And what you'll find there is it's not just a question of what you know, but how you act. So a big initiative that's been worked on here, both with the League of Arab States, but also a number of countries in the region, is on the whole issue of skills. What kind of skills do you have? So how do you use public speaking, like I'm doing now? How do you present your resume? How do you collaborate on a project? These are all skills that you need to learn in order to be successful in finding employment. And then lastly, I would say, and these are examples of the kind of priorities we're working on, is really addressing this question of violence. So for me there's two areas of work that we're working on. Again, a wide range of countries from Morocco to Yemen and Iran in different ways. Firstly is recognizing violence and addressing it where it occurs. So having teachers, health professionals, social workers who are aware and keep an eye out for violence. The first line of defense is the family, right? But when that line of defense is not there, how can the people who come in contact with children recognize signs of violence and address those signs of violence, whether it's at school, or whether it's through the health system, or whether it's through social workers who have a general sense of what's happening in society and which families are at risk. So that's the first aspect of addressing violence. The second aspect is working on issues around social protection. So I mentioned the emergency cash transfer program in Yemen that reaches 1.6 million people each month. There are similar safety nets in other parts of the region, whether it's Lebanon or Egypt or Tunisia. How to make sure that those safety nets are there to support families in order that they don't feel the pressures economically and politically of society. So those are some of the measures. Of course, it continues to be the case that more than half of the work that UNICEF supports in this region is around conflict and issues of humanitarian preparedness and response, humanitarian action. Our largest program in the world by far is Yemen, as your colleague asked. And the reason is because of the conflict in that country. I mean, it was a country that was facing challenges before, but clearly what's happened since 2012, 2013 has made things worse. And so humanitarian action, saving lives and protecting rights in those acute situations, Yemen, Syria, Iraq, Libya, Palestine, some of the issues that have happened, even with some of the transitions in Sudan, have been areas that we have looked at. Coming to the questions in Palestine, over the past 2 weeks, we have reports that 8 children were reported killed. Overall, for 2018, we also have figures of children who were affected by the conflict there. 59 children were killed in 2018. 3,472 were injured. Those are Palestinian children. 6 Israeli children were injured. And on average, there's about 200 children in detention each month. Children who should not be in detention because, as we have said, there should be juvenile justice procedures in order to address anything they may or may not have done. Those are some of the figures that we have. It's clearly a worrisome situation, and we call on everybody to exercise restraints when it comes to the situation. And so it's important that we continue to be engaged and doing everything possible to protect the rights of children from Palestine, and of course children from Israel to the extent they're affected.
مساء الخير، نهى شعبان من جريدة الأيام. هلا في أسئلة كثير، أنا سورية مقيمة بالأردن. في أسئلة كثير حابة أسألك إياها، بس السؤال اللي هلا ملح كثير، نحن على الساحة السورية وخاصة الشمال السوري، أنت بتعرف الوضع كيف، القصف والأطفال المهجرين هون. يعني من حوالي أكثر من شهر المدارس متوقف التعليم فيها، إضراب للمعلمين، ما في دعم للمدارس، فأكثر من 30,000 طفل خارج المدارس اليوم من أكثر من شهر. وبتعرف إنه كمان فصل الشتاء قادم على الأبواب، يعني بلش بيه. حابة أعرف منكم إنه شو الإجراءات اللي ممكن تتخذوها بهذا الخصوص لهدول الأطفال، كيف ممكن يرجعوا على المدارس، كيف يتعلموا، كيف ممكن تدعموهم، وشو هي الإجراءات اللي اتخذتوها مشان فصل الشتاء. شكرا. ممكن نجاوب بالعربي إذا بتقدر؟
مشان مرة ثانية.
طيب شكرا.
Okay. So thank you for those questions. Let me just say on Syria that the situation is difficult in many parts of the country, but specifically in the northeast of Syria, we have concerns because of recent developments. And indeed, let me actually start with winterization. Winter is coming. Like every year, there's concerns that children, especially if they've been displaced recently, may not have their clothes with them, their belongings with them, and need support. So UNICEF did set aside from its own funds $3.2 million that it put together in order to purchase clothes, blankets, bassinets, and other wraps for small children in order that we get ready for winter. This is something that we do every year during this time of year, and the distributions are done to the most affected populations. So this is also the case this year, and it will be done. When it comes to children and education, it is important as the situation, as there is no longer active conflict in whatever part of the Northeast it's possible that schools resume. UNICEF itself in Syria doesn't get involved in the payment of salaries. This is the responsibility of the authorities. But we do support education through other means. There's ways of getting incentives there. There's ways of getting textbooks, school materials, so that there's fewer barriers to education and school can resume. I think what's been remarkable throughout the Syrian conflict, and from wherever parts of Syria, whatever the views are of any family in Syria, whenever you sit down with virtually every Syrian family, as you know, being from the country, whether inside the country or outside the country, they all still say that their number one priority is education. Because they understand that if their children are going to have any future, it's to continue that learning. And so in the region as a whole, it's a big part of what UNICEF supports, not just inside Syria, which is what I've just described, but also in neighboring countries. So working with the Jordanian government, the Lebanese government, the Turkish government, in order to make sure that access to education is available in whatever setting a child finds themselves. If I can give the example of Lebanon as an example, most Lebanese children don't go to public school, they go to private schools, but there is a percentage of Lebanese children that goes to public schools, around 200,000. And the influx of Syrian refugees into Lebanon was seen as an important moment for the Lebanese education system, where the Ministry of Education in Lebanon, working with partners like UNICEF, UNHCR, and others, invested in that public education system so that it became better not only for Lebanese children, but it also became an opportunity to provide education for the Syrian refugees that were there. So what there is now is, and notwithstanding the recent developments in Lebanon, there's two shifts. There's a shift for Lebanese children that occurs, and then there's an additional shift where more Lebanese children come and some Syrian children come. So the number of children being reached by that system now has now doubled since the crisis began. It's clear that education is a priority for Syrian children. It's a priority for all children. And it's clear how much it's valued by their families. The last thing I would say is we're also working, and this is complicated, so that wherever you get your degree from, whether you get it from Lebanon or Jordan or Turkey or inside Syria, it is recognized. It is recognized, so that if you get a high school degree in Jordan or in the camps or in any kind of district in Turkey, that there is some kind of equivalency, some kind of recognition that those assets can come back with you wherever you go.
شكرا نهى. أي أسئلة أخرى قبل ما نختتم المؤتمر؟ أوكي، شكرا كثير. بس نهى الإضافة على السؤال تبعك، بس الأرقام في داخل سوريا في 2 مليون طفل خارج مقاعد الدراسة في داخل سوريا. طبعا هذا الرقم بيشمل الأطفال في شمال الشرق وشمال الغرب، هذا بشكل عام في الدولة. وبرا سوريا آخر إحصاء وصل عنا في يونيسف في دول مثل الأردن ولبنان وتركيا ومصر وشمال العراق 700,000 طفل. المجموع هو 2.7 مليون طفل خارج مقاعد الدراسة.
لا أنا عم بحكي من شهر لهلا بإدلب حصرا، داخل إدلب أكثر من 30,000 طفل هلا على المدرسة. صوتي عالي.
فهو هذا الإحصاء اللي أعطيتك إياه بيشمل كمان، يعني هو مش بالضبط دقيق، ولكن أنا أعطيك الصورة بكثير عن الدولة.
I just wanted to give a few more pieces of information on Yemen, because the question came and just some facts and figures. I mean, it's important that we recognize that out of a total population of 30 million in Yemen, 24 million or 80% of the population is in need. The number of children in need is 12.3 million. So almost every child in Yemen has some kind of need as a result of this crisis. And we've got almost 2 million children who are internally displaced. So they're displaced from one part of Yemen to the other. And as I said, we're doing everything possible to keep systems going. So one of the key things we've done recently is provide incentives to teachers so that they can continue teaching, and we're doing the same with health workers. And so that allows the 4 million children currently in school to stay in school, but we're also trying to get the remaining 2 million children that are out of school back into school. When it comes to nutrition, there's 2 million Yemeni children who are acutely malnourished, of which 360,000 below the age of 5 are severely acutely malnourished. That's the form of malnutrition that can affect your life. And we're reaching 80% of those children with services through that primary healthcare system that I mentioned. So I think it's important that we are able to continue those activities. Those are some of the results that I wanted to share in addition to the information about the emergency cash transfer program. So it gives you a sense of why it's important to work through those systems and keep the systems going so that you can achieve scale. Because like I said, virtually every child is affected in one way, shape or form.
اوكي خلينا نعمل وقفه قصيره مع الفيلم، وبعدين اذا في حدا عنده اسئله بعد الفيلم فينا ناخذ كمان اسئله.
منذ اعتماد اتفاقية حقوق الطفل قبل 30 عاما، شهد الشرق الأوسط وشمال أفريقيا تقدما هائلا في مجال حقوق الطفل، بما في ذلك حصول الأطفال على الرعاية الصحية والتعليم والمياه الصالحة للشرب. ولكن في البلدان التي تشهد النزاعات أدى القتال والنزوح والفقر إلى جعل المكاسب التي تحققت تتراجع جذريا إلى الخلف. وبينما يستمر العنف في المنزل والمدرسة وتستمر عدم المساواة في كل مكان في المنطقة، تبقى الابتسامة المرسومة على وجوه الأطفال تغذي الأمل فينا بأن يحصل كل طفل وطفلة على كامل حقوقه. يونيسف، لكل طفل كل الحقوق.
اوكي شكرا جزيلا. كل هاي المواد المرئيه بالذات للزملاء من التلفزيون كلها متوفره معنا، فينا نعطيكم اياها جوده عاليه، وكمان للزملاء اللي من الويب ومن يعني بحاجه لهي المواد الموجوده لعنا، وفينا طبعا نعطيكم كمان بيرول وفيديوهات اخرى من اجل القصص. في اي اسئله ثانيه قبل ما نختتم؟
لا انا الحقيقه ما عندي سؤال. حامد البشير سينيور ادفايزر. في سؤال ذكره الاخ هنا عن دور اليونيسف في السنوات القادمه في المنطقه. انا افتكر دلوقتي اليونيسف بتشتغل مع اكثر من 20 دوله في الاقليم، والعمل بصوره اساسيه مركز في التعليم، في الصحة، في المياه، مياه الشرب النقية، في الصرف الصحي، وزي ما تكلم تيد برضه في السوشيال بروتكشن، يعني في محاربة الفقر إلى آخره. ودي كل البرامج دي هي مهتدية ببرنامج التنمية المستدامة في اللي هي اللي وقعت عليه برضه كل الدول في الإقليم، يعني Sustainable Development تارجتس. فاليونيسف هي حتظل شريك اساسي زي ما ذكر تيد للدول في المنطقه، وعشان تحقيق يعني حقوق الاطفال تكون كلها تحققت بشكل كبير. شكرا.
شكرا كثير حامد. زملاء والاصدقاء شكرا كثير للحضور، وان شاء الله بنضل نلتقي بمناسبات منيحه مثل هذه مثل اليوم. شكرا كثير.